Hello, Alicia. Thank you so much for joining me today. And thank you so much for speaking at the NCH Conference, our very first online conference that we're having in September. So this is just a short interview so that we can give our audience a flavour of what you're about.
Now, I have been working with the cancer patients, mental health patients during the last 20 years on the daily basis. I am a psycho-oncologist, clinical psychologist. So as an integrative psychotherapist, I had training in body psychotherapy in France and in Poland. And I started with breathing practices, short breathing practices, which led people to the state of inner, let's say, focusing on inner awareness, on their inner process. Sometimes it was the conscious meditative process, or sometimes it was the hypnotic process leading to the change and cathartic reactions. I was very interested in neurobiology and psychoneuroimmunology. This is my, let's say, personal choice, where my soul of the therapist was led to this certain way of intervention where I do not have the strict contract. I do not work for long. I adjust to the state of the patient. I follow the patient where I can, if procedures are too traumatic, like the magnetic resonance or radiotherapy with a mask when the patient has claustrophobia. So to relieve the patient quickly from claustrophobic or panic reaction. And it's almost always based on a hypnotic trance, because I do not have time for, let's say, cognitive working on the subjective patterns of experience.
And what's so wonderful about breathwork is that once someone comes to understand it, then they can take it wherever they go.
So every intervention counts.
Sounds wonderful. So leading us into what are you going to be covering? Don't give too much away, but just a taste of what you're going to give our audience.
I will be very happy to present the breathwork practice integrated into the practice of every possible psychotherapeutic modality, because the breathwork process might be totally technical and behavioral, might be cognitive, might be aware and meditative, mindfulness-like, and might be cathartic, emotive, expressive, and might be trance-like. So everyone may use breathwork to enhance their effectiveness at the battlefield, let's say. And I will describe several cases on how to treat quickly claustrophobia, panic disorder, PTSD, and probably much more, because I work with the patients on a daily basis, so I could just describe last 3 days. Yeah,
I'm sure.
Yes, and it will be shown in the context of polyvagal theory that helps us to really understand what are we doing with our body, with our breathing, and with our vagal nerve. Yeah. So this is the context I am going to show it in, and that gives you everyone nice psychosomatic insight without too much theory or too much molecules and receptors.
I think a lot of this breath work and, like you said, the polyvagal theory is stepping more into the mainstream. People are hearing a bit more and wanting to understand more about it, which is really exciting.
And I knew that something was working in the way it was working. For example, slowing down breathing show.
Well, thank you so much for chatting to me today.
I'm so happy I will be with you at the conference.